Hello, everyone. I think we are up live now on Facebook.
Welcome to another edition of Greater Living.
Yeah, good afternoon.
GBMC.
Beautiful day, right?
Yeah.
Even in here, even in the studio.
Couldn't put a coat on because it's so nice outside.
Well, I'm Mary Beth Marsden,
take yours
and
off if you
this
want
is
to.
Don Scott. And if
Hello.
you've been to GBMC recently, you probably already know that because you see him there on what day again?
Thursday. I run the hospital there on
Yeah.
Thursday morning.
Yes.
From the lobby.
If you want to survive, don't go on a Thursday.
I only do surgery on request.
So today we've been talking about such a big, broad topic that,
Wow.
I mean, I have to say, I don't know anyone who's not affected in some fashion by cancer.
Yeah. You can't go anywhere.
If you're over the age of 25, let's say, or maybe even younger, someone you know, someone in your family, a friend's family, it's just everywhere. And
those who haven't had it are afraid they're going to get it.
yeah, but on the flip side of that too, I think there's less stigma to it. I think people can say the word cancer. Remember the day when you couldn't even say that? Everyone was like, the C word, right? So I think now you can talk about it freely. We work with people who are going through treatment, who it's just become, I hate to say more normal, but almost it has been somewhat normalized, and that's helpful for people who are dealing with it and feeling pretty isolated maybe in the moment. But anyway, we should introduce our
Yes,
guest.
before you speak, you were about to. Brandon Costantino, who's in charge of Oncology Support Services at GBMC, program manager, I should say, the Berman Cancer Institute. And so I guess we should start off just by saying, what are Oncology Support Services? Exactly what it sounds like or more?
Yes, exactly what it
That
sounds
and
like
more.
and more.
Yeah.
So we have on our team is we have 2 social workers. We have an admin assistant who does a lot of things, including scheduling transportation for patients. She meets with them when they're learning about the chemotherapy they're going to be taking, along with about 1,000 other things, including keeping me straight, which is a big deal. We also have an outreach coordinator who does a great job of going to health fairs and promoting our program. She sets up dinners with the doctors to educate primary care physicians on certain topics, and again does 100 other things. We have a survivorship nurse, which would be the main topic that we'll be discussing today, Felicity, who does an excellent job of meeting with survivors, along with planning a lot of our survivor events, the Cancer Survivorship Celebration. I pointed back there, it's not up back there, but we'll be later.
Sure.
And so, and a patient resource navigator. We don't, there we go, magic. We don't have, we're in between navigators at the moment, but we have a patient navigator who also handles the logistical side of having cancer. So assistance with paperwork like FMLA for your job, working with transportation resources when we have them available, if we can find them, assistance with medications, and a lot of other the practical aspects of having cancer, and making sure that we get people to their treatments on time as scheduled and they complete them the way that is optimal.
So I get the sense then if I'm diagnosed with some form of cancer and I'm facing radiation or chemotherapy or some other kind of treatment, you're the people I see next. Right? I have a doctor, I have an oncologist, I have my family, but you're kind of this huge safety net so that I'm not left to figure out the rest of my life dealing with this. Yeah. It's pretty incredible.
Yeah, so, if I had to put it into an elevator speech kind of thing, we've got a couple floors to tell you what we do. My main goal, in my opinion, is for us to be, we want you to focus on getting healthy or getting better in whatever way that means for you based on your prognosis and diagnosis and all of those things. Let us help you take care of some of the things that may be challenging you or keeping you from doing that, right? So, again, if you're really worried about communicating this with your children, talk with our social workers. We will work with you on how to do that. So instead of sitting home and fretting about it and not knowing what to do, come see us and we will do our best to help you. We can't solve every problem, but we will do our best to solve all the ones that come to our door.
And so you're right there on campus?
Yes, ma'am, right in the cancer center, right on the same floor that they'll see their doctors and get their infusion right down the hall.
Now, you pointed out your survivor nurse by name.
Yes.
It would seem like she must be one of the most overworked people in the hospital.
That's why she's not here.
That's right. She actually is on vacation right now.
So you have
well-deserved.
Much deserved, yes.
But you have a relatively small staff, but hardworking, I trust.
Yes, we stay busy. And yes, everyone in the department is hardworking, but I think the thing that's so great about it is we all want to be doing this. It's I don't know that you can if you don't want to be doing it. It can be tough at times, but it's this constant feeling of we're doing something to help and we're making somebody's life a little better, and it's a
lot better.
Yeah,
I would imagine.
Well, I hope so. Yeah, that's the goal.
And even though there aren't many of you, as Don pointed out, you're often a resource for another service, right? So you can guide people to getting what they need,
Yes.
not necessarily always providing it yourself.
Well, correct. There's a lot we cannot provide. I mean, the idea behind that is that we want to either be the people who can solve your problem, or we want to get you to the people who can solve your problem. And so either way, you need to come see us. We want to, so like patient navigation at times is literally navigating people through the system. Insurance is complicated. Where to go in the hospital is complicated. What do I do next is complicated. What is this form even asking me because it's written by a lawyer or whatever? So we try to navigate people through those difficult logistical aspects, as well as our social work team works on counseling with patients on a regular basis, and there's a lot of very difficult emotions to navigate through, and our survivorship nurse does the exact same thing, navigating through these very complicated emotions of one of the things we hear from survivors all the time is they've been watched over very closely by a physician for a long time, and now they've been told they're not coming back for 3 months. Now I'm,
How do they process that?
Yeah,
what do they do with that?
It's
Yeah.
almost surprising. You'd think, and I don't want to speak for all survivors, obviously, this is just something that we hear from time to time, but to have the fear of being done with treatment be almost as strong as the fear is going into treatment is something that I think a lot of people don't realize or think about unless they've been through it. And our job is to make sure that we can help you navigate that as well as during your treatment. We don't stop just because you're not coming back for treatment anymore.
Is the program available to anyone who has an associationship with GBMC and has cancer? And do they have to ask for it, or will they be told about it?
Yes. So
I keep answering yes.
Yes, yeah. So the answer to the question is they can be referred by a physician, by a family member, by a nurse, medical assistant, to us to say, hey, listen, I think this person would really benefit from survivorship. Can you reach out to them and talk to them? And we will do that. Also, some patients will contact us and say, I have a friend who's being treated here, and she mentioned she had this great appointment with this social worker or survivorship nurse. How do I do that? And we'll say, well, you came to the right place. You talk to us right now. So the answer to your question is, whatever way, I would never want how to get to us to be keeping people from getting to us. So whatever way you get to us, we'll do what we can. And don't worry about what you need. We'll find out who the right person for you to speak with is. If you need something and it's not clinical, it doesn't need to come from a doctor or a nurse, come see us.
Wow. I would imagine one of the hardest things for people, particularly if they're newly diagnosed or maybe even just newly into their treatment, is just even keeping track of, what their chemotherapy is or what their schedule is or what stage cancer they have. I mean, your brain is in overload, and so to fill out a form for work or to figure out transportation would be completely overwhelming, and you can kind of lift that off their backs.
Right. That's always the goal, is to give you help in a way that makes things easier for you. If we just handed out a list of places to call and you're already on the phone all the time with family members calling to see how you're doing in the physician's office, and you're having side effects and you're calling the nurse to find out what to do about those, if I just give you a list of places to call, and sometimes we do have to do that because sometimes it is something that the patient needs to request themselves, but where we can step in and fill out a form or work with someone directly at the same time as they're already here for an appointment to fill something out. If you're in an infusion chair for 3 hours, this is a good time for us to help you get something accomplished if that's what you want to do. If you want to relax, obviously do that too. And so, we want to remove the strain and difficulty of being a patient or a survivor or a family member of a patient or survivor or their best friend or whomever.
Okay, you mentioned the survivorship celebration that's coming up and referred to the slide that's up. Could you tell us more about that?
Absolutely. How long do we have? It is one of my favorite things that we do, and it is a celebration of the entire reason why everyone that works at the Cancer Center comes to work every day. Right? It's working in an oncology center is interesting because really your ultimate goal is to put yourself out of business. Right? If we could cure cancer, and then there would be no reason for us to, we'd have to go find a new career, which would be fantastic, by the way. That would my wife.
There's always someone to help.
My wife might not agree with me about this, but and so I think that with the survivorship celebration, what's so amazing about it is there's so, and Dr. Donegan said this a little earlier, but it's so true, and it should be repeated, that it is a room full of people who have, even though everyone's situation is completely different, there is a commonality to the people in the room and the situation they've been in. And then the folks that are there from their care team have been with them in many cases since they started, and see them every 3 months or every year now that they're out of treatment. We also have patients, we define survivor as soon as you're diagnosed and you're living with cancer, you're a survivor of cancer.
Sure.
And so we have patients who are still getting treated, and they come to the survivorship event, and we get to see them, out of context, and they get to see us out of context, and it brings people together as people, not as patients and doctors and MAs and Oncology Support Services, but as human beings who are here to celebrate this wonderful thing.
So a big party.
It's a great party, and we have a tremendous amount, thanks to AutoNation, as you see there, they actually gave us a very generous donation, which literally doubled our budget for the party.
Wow.
Allowed us to do some things we haven't done before. We upgraded the food a little bit. We were able to do a lot of other things. And without those kinds of donations, we can't do things like this. So it's a tremendous help. But this party is so important to us, I think, to the whole Cancer Center, because it just is genuinely a celebration of exactly what we hope to accomplish every time we come to work.
And before we get to a question, when and where?
It is June 10th, and is at the Valley Mansion on Cranbrook Road. And I was so nervous about getting that wrong, I gotta be honest with you guys. So it is, and so it is limited to, I should say it's limited to cancer patients who are coming to GBMC for their treatments, because we just unfortunately don't have the ability to open it up to the community at large. And I should say it's almost full already, which is a cap at 400 survivors. So it's not a small thing.
You're going to have to get bigger, I think.
We're hoping to.
Yeah.
It's
We have a
always the
question,
plan.
I believe.
We do. We actually have a comment and a question from Megan. So Brandon's lovely wife is watching, so make sure you say hi. And she says, Brandon and his team are not only supportive, but a wealth of knowledge. Thank you for all you do. I think we all agree with that. She also asked, do you provide service? I think she knows the answer to this, but she's asking it anyway. Do you provide services for the caretakers or just the patients? She actually has two questions, so if you want to answer that one first.
I owe my wife, I guess, $20 now. So the answer to the caregiver question is, I've never met a caregiver who isn't going through this also. There's no way to be with your loved one, especially a spouse or a child of the patient, and not experience the emotional ups and downs and the side effects. Even if it's by proxy, it has a large effect. Dr. Donegan said it earlier, which is exactly right. Caregivers, one of the things we have to counsel caregivers on a regular basis is they need to take care of themselves. One of the things I used to say all the time in my previous career was, if you think about getting on an airplane, the first thing they tell you is you have to put your own oxygen mask on before you can put someone else's on, because you cannot put someone else's on if you yourself aren't breathing and are passed out. And that is, in essence, what caregiving is. It is difficult to take the time for yourself because your focus is constantly on the person who's feeling sick, but you have to, or you won't be able to continue to do so. So yes, we absolutely work with caregivers. We will talk with them, even if they just need to vent and unload and just get some things off their chest, and we're here for that too.
In broad terms, what are some of the biggest issues that you find cancer families, I'll just say, are going through? Is it issues in the workplace? Is it navigating the ever-changing healthcare system? What are some of the biggest issues?
Well, I hope I'm not being annoying, but the answer again is yes. Those are all the biggest issues. If you're employed and you're diagnosed with cancer, that can be a very difficult and tricky thing, depending upon your employer. Some employers are so understanding and wonderful, and they help out in every way they can, and that's what, by the way, that's how things should be. Some are not. Some simply can't afford to be. They're small companies.
Some patients, I'm sure, don't want to tell their employer as well.
Oh, right. Well, then they're not. They're obligated to get FMLA and to protect themselves legally in that way, but they're not necessarily obligated to explain exactly what's going on to the employer based on HIPAA.
So in your mind, I mean, you seem like the kind of guy who is always thinking like 2 steps ahead and what you can do better to help your clientele and the people that are in your village. And what do we need to do? Do we need to create more awareness? Do we need to, how can we make a better society for all these people who are dealing with this?
That is a heavy question.
Yeah, it is. Yeah, you can't say yes to it.
You finally caught me. I was really hoping to just keep going down that road. I will say this. One thing is we need. Okay, I don't want to get on a soapbox. This is my own personal opinion. I think we need to depoliticize healthcare. Healthcare is not a political matter. It is a human matter, and we need to find a way to have it, to make it a way that people can afford it, especially people without all the resources that many of us are blessed to have. That's just my own thing. Also, we need to work as a culture at healthier lifestyles so that we can avoid some of these lifestyle cancers that we get. We need to continue to press awareness. I think maybe with awareness, for instance, let's take breast cancer. We've all worn pink at some point. We've all been aware of breast cancer, but maybe strengthen our knowledge of breast cancer. You know, what is a triple negative breast cancer versus a ER positive breast cancer and things like that. And one of the things I notice is a lot of people who have a more distant relative who've had cancer, an aunt or an uncle that don't live in the same state, they don't know what type of cancer they have or what stage they are or what their prognosis is because we don't discuss it. You know, your uncle has colon cancer. Well, is it bad? You know, is it stage 4 colon cancer? Is it stage 1 colon cancer? Is it only surgery? Is he going to go for chemo? We don't ask these questions. Right. Maybe we don't want to know. But I think those kinds of conversations could help us strengthen our awareness and understanding of what's really going on. And maybe with patients that are in your life that you're not a direct caregiver for, instead of just dropping off some food, I think something that would be really nice is asking what they need. Because sometimes they've already had 12 meals dropped off, and I don't have one fridge. But maybe what they could use was a ride to treatment next week, and can you help me with that? So. As a community supporting this population of people, I think there's things we could do better. But as a society, in terms of a lot of not just cancer, but a lot of things, I think the biggest thing is we need to figure out how people can afford to get these treatments that they need to survive.
Okay, I want to keep you straight at home. I think there was a part 2 to make this question.
There was, and actually I have another question.
Oh, okay.
And we're almost out of time.
Yeah.
So
I talked too much.
No, we just need more time.
So Megan's second half of her question is, what services or support do you provide the caretaker?
I think you
Yes.
pretty much
Kinda
covered
covered
that.
that.
So
Okay.
we'll move on to the next one.
All right, next one. Sorry about that. This question's from Laura, and she wants to know, are patients charged for Oncology Support Services? And I want to add, can you tell people how they can access the services?
Yes. Let me start with the first question, which is no. We do not bill patients for our services. We do not generate any bills. We do not bill any insurance. We do not charge a single penny for anything that we do.
Wow.
Part of that is it wouldn't really make sense if you come to see me because you can't afford your medical bills and you end up with another bill. You're going to have some questions about what this service is really offering. Sure. And there are things we could charge for, the nursing with the survivorship. Again, as Dr. Donegan said, Felicity meets with patients. She gives them their treatment summary, what they've already had, all the treatments they've had, what their diagnosis was, and all those things I just mentioned we should be asking about more often. And also their care plan, what they should have moving forward. Do I still need mammograms? Do I still need colonoscopies, et cetera, and so forth? And we could bill for some of those things, but we don't because we don't believe that we should. That would, I think, create a barrier for our most vulnerable populations to get the services that they probably need more, at least generally speaking, than the population who has the good insurance and a good job and a steady income. We would not want to create that barrier for those patients, so we don't bill for anything that we do. And we're supported by Legacy Chase, which which I'm sure we'll pitch in a moment, which is on September 29th this year. It is a horse race at Shawan Downs.
Yeah, it's a big one.
Magnificent event, and the proceeds support my department, which is I can't be thankful enough to the hospital for even doing that. And so that allows us to continue to do the things we do without charging money to the patients. And I also want to do really quickly, there's a couple of members of our Patient Family Advisory Council here with us today. Beth Nardone, actually, the chairperson, will be coming up later.
Yes, we'll be talking to her.
And they do such a good job as cancer survivors and a few family members that are on their caregivers of helping us improve. One of the things I love about my job is we're constantly talking about how can we be better tomorrow than we were today. And the Patient Family Advisory Council gives us a patient perspective on what we can do to be better, which is invaluable. You cannot replace that. And they help us with the survivorship party. They help us with Legacy Chase. They help us know what we could do better next year compared to the year before. And they're a big part of planning this event. So I just want to say thank you to them while I'm here up here.
And thank you for what you do.
Yeah, Brandon, thank you so much. It was great to meet you and great to hear about what you do every day.
Brandon Costantino, Oncology Support Services at the Berman Cancer Institute at GBMC.
Thanks for having me.